The largest expenses for the elderly are vision, dental, and hearing, yet Medicare doesn't provide assistance. Do you support expanding this coverage for the elderly? And how do you propose paying for this in light of the current $19 trillion national debt?
Ron Leach?
Yes, I guess the original question was as far as enhanced Medicare, dental and vision, correct?
Dental, vision, hearing.
Yes.
And how would you pay for it?
Absolutely. I would advocate for an expanded and enhanced Medicare, and for that matter, I'm kind of a fan of Bernie Sanders' idea of Medicare for all, going towards a universal health care finally in the United States. We spend about 18% of our GDP for health care and deliver a result that, according to the World Health Organization, ranks us about 32nd in the nation, right there with Costa Rica and Cuba. Doesn't seem like the best use of our money. And as far as paying for it, first off, it'd pay for itself because we would gain in several different areas. One, we would have a healthier, more productive workforce. I work in occupational medicine right now as a physician assistant, and I do fit-for-duty physicals for folks all the time, and I see them come in with multiple comorbidities, things that should have been treated or have been intermittently treated that have been left go where they are now unfit to the workforce. Had we invested and we provided that care and made them able, they would be productive, returning to our tax revenue, and that pays for itself. Second, our current system makes us less competitive as a nation compared to other nations. Every other first world industrial nation has a universal health care. The burden on our small businesses and businesses that our competitors do not have to face. As General Motors and Chrysler were going into deep trouble during the 2008 Great Recession, part of the problem was that before they put a second of time, an ounce of material into a vehicle, they already had a legacy cost of $2,000 to $2,500 in legacy medical expenses that their competitors don't have because of our employer-based health care, which is a loophole legacy from World War II that has outlived its time, and we need to move on to universal health care. And finally, on the matter of national security, about 3 or 4 years ago, the Department of Defense raised the red flag and said, hey, you know, our prime recruiting age population of 17 to 23-year-olds in the United States, less than a quarter, 24%, meet the initial physical standards to even get a foot in the door to possibly be the candidate for our armed forces because of the dismal state of our medical system, health care, preventative meds.
Thank you very much, Mr. Leach.